Assalamu alaikum and welcome back to Parenting Hour. You're tuned into Unity FM 93.5 here in the West Midlands and 101.5. I was forgetting Inspire FM, that your channel that we are tuned into also in Milton Keynes and Luton. This is a pre-recorded show, but as I mentioned in the beginning of the show, if you have any questions or any queries or would like to hear more about the information that's coming out about vaccines and you're a bit confused about your children, please do call the studio on 0121 772 and leave a question there and we will get that question answered. And Dr. Zoyah, that's with me at the moment, will answer that query. MashaAllah, she's gone through so much detail about the vaccinations, and especially we focus on, before break, the babies right up to school age. And you gave us a list, and I was trying to keep up with all the different things from 6 to 8 weeks and 12 weeks and then 16 weeks and 1 year. I think it was 18 months after that. I couldn't keep up with you writing all the information. But of course, it's mentioned in the show, which is repeated again on Sunday. So if you want to catch that show again, it is repeat on Sunday between 11 and 12, inshallah. Welcome back to us. How are things? How are you feeling now after the first half of the show finished? Are we draining you? Because you've had so much information. Indeed, it's a lot here that we're giving to our listeners. We did talk about the school going. So is there other than vaccinations in school once the child starts school? Was there other ones that we need to discuss?
So the main one is the flu vaccination, which is offered every year in school. And that depends on where you live, if that service is available. But typically, yes, you will get a letter often in September time about your child being eligible for the flu injection, and that can be delivered in school. And you'll be advised that there's two options. That nasal, which is the most commonly given, or you can opt for your child to have the injection. So like I said, the nasal vaccination has porcine gelatin in it. So you can use the IM, which is more effective. And those are your two options. So if your child is off sick from school for some reason, doesn't want to have it done at school, then you can actually book in with your GP as well. So that's available. And then other than the flu jab, you wouldn't necessarily get any other vaccinations at school until your child is a lot older. And then we're talking about secondary school. The boys and girls aged 12 to 13 will be offered the HPV vaccination. And that is to protect against cancers and genital warts caused by a specific human papilloma virus. And that virus, if it's present in the body, can then increase your risk of developing cervical cancer and other genital or gynecological cancers. So that HPV vaccination schedule is relatively recent. It's not very, very new, but it is within the last decade or so. You might have recently heard about it if your child is of that age. And a lot of Muslim parents might think, actually, this doesn't fit in align with our values, or I don't think our children will be undertaking the high risk activities, which increases their risk of catching HPV. But it is important to be aware that you can catch HPV through non-contact intercourse as well. In Australia, they've actually been successful through their HPV vaccination schedule, and they've been able to eliminate cervical cancer in their country because of it. And I think this is where the UK is hoping one day to be at that stage where we then might need to reduce or might not need smear tests as much for women as they get older, because it's the HPV virus that increases your risk of cervical cancer. That might be something that comes in due course in the future, depending on the success of the HPV vaccination campaign. If you're unsure about it, like I said, you can speak to your health professional. But a lot of people nowadays now go online, do their own research. I would recommend that you look at NHS websites. The BIMA website also has specific information about all the vaccinations, including HPV and cervical cancer, and they've got it in lots of different languages. So you might be, if you struggle with English, you might be able to see a leaflet or information in Arabic, Bengali, Gujarati, Urdu, Polish. So they have lots of different languages that you can have a look at. The other site I direct you to is patient.co.uk. So I'd recommend that you have a look at that for a reliable source. So nowadays, YouTube, TikTok, Instagram, social media is really prevalent, if I can say, and we can find ourselves turning to social media for our information. And one thing I'd say, it's just really important that whoever you're getting your information from is either medical professional and trained, so they're able to give you the right, correct, evidence-based information rather than their opinion. So when things are on social media, it's really hard to decipher between fact and opinion or personal experience. And anecdotal or personal experiences can be very different and variable. But what we want and what you want as a parent is to get that information that is correct and has the most evidence behind it. So that's why I recommend, if you are looking at social media, you look at those that are medically trained or qualified.
That's wonderful information to give there to people, because sometimes the wrong information gets sent on WhatsApp groups and repeated and repeated and repeated, and people forward it. And it's often, that sensational thing that is not true at all, and people are worried or about it and feel that what is right, how can I find out the right information? So you mentioned the NHS, you mentioned BIMA there, in case people haven't heard. So that is the British Islamic Medical Association, isn't that correct?
Yes, that
BIMA
is.
stands for. And it is really a great organisation, and the one that you were shortlisted for your powerful work that they can go to find out more about this.
Yes, and I'll just do a disclosure of interest as well. I am currently looking at becoming a part of the BIMA immunisation team, so I'll be hopefully getting on board with them. And I just like to highlight that BIMA is a charity; it's all run by volunteers, and all and most are health professionals. So they are people who have either trained in the UK or gained UK-based medical degree or further qualifications. So it's reliable information with an Islamic slant for your listeners. Um, I hope that's helpful, and I'm sure we could provide some links if that would be helpful as well.
I think would be very useful, and of course, if you can't get the name or anything, do call the studio, and we'll be able to tell you more about that in the studio. But yes, it is really wonderful to see that BIMA is there as an organisation, as a go-to organisation to find out information about so many health topics, not just like what we're talking about now here, health and vaccinations, but so much is up there for people, and to try and break that link between medicine and our Islamic culture and knowledge, and break down those misconceptions. Mashallah, they're doing great work, and it's great to see that you're volunteering with them and doing more, which kind of leads me in a little bit into thinking now that I want to find out more about your success, because you were, of course, shortlisted for an award there. You do things a little bit differently, and I know you're based up north, so you're not based in the West Midlands. I think it's in West Yorkshire you're based. So tell us a little bit about how you manage things. There's lots of Muslims up in West Yorkshire and lots of communities up there. So how did you, how were you so successful in this work that you're doing?
Yeah, so I work in Keighley, which is a town in West Yorkshire. It's close to Bradford, which your listeners might be aware of. So Keighley is ethnically diverse. There's a large Bangladeshi, Pakistani community. It also has a large Polish and Czech population as well. It is quite socio-economically deprived. There is high levels of deprivation within the Bradford district as well as Keighley itself. And traditionally, it's well known that those from ethnic minority backgrounds are more skeptical about vaccinations. There is higher rates of vaccine hesitancy, less uptake, both with childhood vaccinations and COVID. So during the COVID pandemic, the Modality Partnership thought about how can we get the vaccinations to those that need it the most. So we knew COVID was affecting ethnic minorities greater than it was affecting non-ethnic minorities. And ethnic minorities had a greater morbidity, which means more chance of getting well, and mortality, which means more chance of dying from the disease. So what they did was we took the COVID clinics to the community. So we went into community centres, mosques, shopping centres, and we found at the time that actually uptake was better when those that were delivering it were from the same ethnicity. So there's a greater degree of trust, and actually going to where people go or congregate or trust was more successful in delivering the program versus just expecting people to come to them at the surgery. So once COVID settled down, we decided to take child immunisations and use the similar approach. So what we set up was baby wellbeing clinics, where we took the clinic, the doctor, the nurses, the injections into the community. So we had a shopping centre unit, which we ran the clinic out of. And this runs on an approximately monthly basis. And it's in the centre of Keighley in the shopping centre, right by the bus stop, all level, flat, pram-friendly, wheelchair-friendly. And how the clinics run is not only are there pre-booked appointments, so you come for your appointment slot, there are walk-in appointments, so you can just turn up. You don't even need your red book. You can come. There'll be somebody on the desk who's able to direct you to myself. So it's me who runs the clinic. So I'm there at every clinic session with my laptop, with my computer, access to your medical records. So I can check if if you or your child has had the vaccination, are they due, when are they due? And if you wanted, we can offer a walk-in appointment with the nurse there and then. The shopping unit, it's an open bay. It has a play area as well, so children can play while they're waiting, or just to build a bit of confidence. And then we also offer free baby weighing, so you can weigh your child, get your injection, speak to myself as the GP if you've got any immunisation related queries, all as a one-stop service. And we advertise 3 months in advance. And we don't work alone. We work with the community partnership. So we work with something called Maternity Circles, which is a local charity supporting young families, mums, and helping them with any early childhood issues, feeding problems. We're able to direct people to breastfeeding support, early help, look at mums or paternal, maternal mental health. So we're able to offer like a one-stop service, and that runs throughout the year. Since 2022, we've been running these clinics, and we found actually by offering that service, which is in the community, you don't have to come for a pre-booked appointment, so it gives you flexibility, has really driven up immunisation rates. We've gone from low 40-50% uptake to hitting almost 90% uptake over the last 4 years, really. And despite being in the Bradford district area, which has the third lowest uptake nationally, our rates have gone up, and everywhere else in the country has gone down. So not just are we booking the trend locally and regionally, but actually compared to the national data, our current immunisation uptake is for measles, mumps, and rubella is 88%, and it is actually a lot lower the whole of the rest of the UK, and I'm pretty sure it's around 85 or less. So we've actually shown that this method of taking healthcare into the community works, and thus we've had a bit of national recognition for the work as well.
Wonderful, wonderful way of doing things. But of course, it makes sense indeed that we go to our communities and we go and deliver within our communities, and we don't expect them to come to us, especially for mums, in particular mums that are busy and busy household, and often they're not just looking after that baby, but they might have an older, their mum or mum-in-law that they're caring for and looking after as well. And time is short. Daytime hours are short when you're in that position.
Yeah, definitely. And this is why we offer this 3 hour window, and we pre-release the 3 months worth of dates at once so that you're able to put it in your calendar. And by having that 3 hour window, you're not rushing to be there for your 9 o'clock appointment. And if you're late by 5, 10 minutes, unfortunately, you can't have the immunization. So we have that degree of flexibility.
Mhm.
And I think that flexibility is so important when you've got young families who might have children with additional needs.
Mm.
One thing that I think is very successful from our clinics is that we're able to cater for those with additional needs by giving them the time, space, a different environment. So going to the doctor doesn't always end up being correlated with getting an injection because it's not where they would usually go. So some children always associate that going to see a doctor and you're going to get a needle in the arm. Actually, by taking it out of the GP environment, for those children, actually, they might not be so hesitant to go see a doctor when they are unwell. And what I'd say is we run with open cubicle bays. So there is a degree of privacy for your appointment, but there is no door that is being shut on you or your child that might make them feel claustrophobic or conscious. We also have the capacity and the facility to be able to allow children to come see the environment, gauge if it's for them. Same for parents. And there's no pressure to have the injection or the vaccinations on that day. You can always come back. And I think it's always important to have that option, be able to come speak to a GP as well. So
Mm.
you're able to come speak to myself, and it's always me.
Mhm.
This is part of my role at the practice. Is I'm child immunization lead. I'm always there. So there's that continuity of face as well, which I think we lose in modern day general practice.
Definitely. Wow, it sounds great. No wonder you have been nominated and won awards, and people want to know about that and replicate this in other areas around the country. So maybe if people from Birmingham, West Midlands, or in Luton, Milton Keynes, if it's not down, if you're not doing this, something maybe you think about to take on or pick up the phone and have a chat to you and see how to do this and what are the costs around having this service, that walk-in friendly service beside the bus stop, as you said, so that you can push in the buggy and push, if you're in a wheelchair, also have access to it. So that sounds amazing indeed. I know we have roughly about less than 10 minutes left. We've about 8 minutes left indeed. Time goes very quickly on the show. And there's other things that you also do as well, other projects that I just want to touch on before the time end. I believe some things you do around healthy Ramadan, another one about multi-generational household project. So if you could tell us a little bit about that, please, that would be wonderful. Thank you.
Yeah. So one thing that's really important to me is giving back to the community, and especially the Asian Muslim community, because often we're underserved and underrepresented. And one thing that I think I've realized over my time as the doctor over the last 10 years or so, really, is that actually we don't consider Ramadan as a month of reset. We think a lot about it, the spiritual side of it, and getting our prayers in and reading the Quran. But do we think about our health in that period of time? Are we thinking about making sure we drink enough? Do our medications need modification because we're doing fasts or long fasts? Are we thinking about the impact of our health on our ibadah? And I think sometimes that can get forgotten. Are we eating the right kind of food to sustain our fast, give us the energy to see us through, to be able to feel as fresh or as healthy as possible during Ramadan? And actually, we found that, large meals, people are gaining weight in Ramadan, not losing weight, despite eating theoretically one less meal a day. And why is that? Why are we becoming unhealthy in the month that is supposed to be our healthiest in a way? So what I run is around healthy Ramadan talks where we look at the type of food that you're having, what can we do to optimize your exercise or your hydration, what medication needs changing. And now sometimes we don't realize that actually our medication might need to be stopped or reduced, or there are certain conditions where it's permissible for you not to fast. And what are those conditions? Are we aware of the signs to look out for? So that's one aspect that I cover. And briefly, just touching on the multi-generation household project was a pilot that I was involved in as the lead GP. And we were looking at homes which have multiple generations in them. So that's thinking about homes where grandparents and grandchildren live together. So traditionally, we found that those households have lower uptake with screening programs. They're more likely to have poor health outcomes. And you wonder why is that? What's the reason? It's because uptake is poor. Health engagement is traditionally found to be poorer. So people are more likely to have more health problems, seek less help, and then become develop more complications or become more unwell as a consequence. So what we did was we did a 6-month pilot where we identified those households, made contact, went to visit them at their home. So we came to you in the evening, the outside work hours, and we did a bit of a health MOT, make sure that your medication's right, you've had all the screening tests that you should be having, and why, if you haven't, why haven't you? Can we facilitate and help with that? Have you had up-to-date blood tests? So it's kind of like a MOT in your home for you. And we were able to offer flu jabs at home. We were able to offer immunisations at home. We were able to explain screening, bowel, breast, cervical screening at home. So then we could use follow-up appointments with in this practice for any blood tests, any tests that needed to, smear tests that needed to be done. So that was a really successful project. And I was able to pick up somebody with a life-threatening high blood pressure that had to go to A&E, somebody with potential cancer, and lots of other medical problems that might have been overlooked or missed. And increased screening engagement. So screening is where, rather than waiting to catch a condition and then treat it or address the complications, it's trying to catch it early. So very early signs of breast changes or cervical smear changes or blood in your stool and the bowel cancer screening. The other one is the aortic aneurysm. Why are we ultrasounding your abdomen? What's the importance of the screening programs? To highlight those to the community in languages that they speak. So the information was delivered in Bengali as well as Urdu, and non-English speaking information resources were used. So that was a successful project that I was also involved in.
MashaAllah, mashallah. I mean, this makes sense, but I suppose it costs more money because it's like a home visit that you're doing for people. But I would never have thought that large extended families had more issues and that there was some data around this than living alone. Because you think when you're living with others that if you are complaining of a pain or ache, that somebody would say, oh, you should go see your doctor. That somebody would remind you of that compared to if you were alone, that they mightn't see you when you have got that pain or ache. So I would have thought it was the other way around. So you're really shocking me this evening in saying this, that it's important for this. Was there an age group in specifically that you looked at for those people over a certain age, or
No.
how did you categorize? How did you go exactly to those families?
So we looked at people with more than 6 members of cohabitants in the house, and typically ensuring that there was a degree spread of age. So even if a household only had one older person and lots of young children, we still included those, and we offered everybody a visit and the option.
Wonderful. Thank you so much. I know we're coming towards the end of the show, but that is great information for our medics that are also tuned into us this evening, that are in their cars, hopefully driving home, to think about that. How could that project be replicated in other areas to have the success like what you had, inshallah, in helping our families and talking about things? Because Yeah, it is often you put things, something has happened and you put it aside, oh, it's all right, I'm not going to mention anything. But when you have somebody there that come to see you specifically and doing that MOT, as you mentioned, from the top to your toes, kind of, and they're having the time to spend with you, that's amazing, amazing work. I would just say congratulations for doing that. I'd love to see more of that in our communities, and hopefully that can be replicated and picked up, inshallah. Jazakallah khairan for all your time and your effort with us this evening and everything you have taught us this evening, inshallah. Is there any quick word that you'd like to give in the last bit of time that we've got left?
Often there's a conception in the media that GPs or doctor surgeries are too busy and we mustn't disturb them. But I would say if you've got a health question or query, you want to check if you're due any screening or if your child immunization needs to be done, please contact us. And that's the only way you're going to find out. If you don't make contact and expect to receive a letter or to have some contact from the surgery and you think, oh, I'm sure they'll contact us if I need something, that please contact your surgery yourself and ensure that you're getting the health and screening that you deserve and your family deserves.
Brilliant message, mashallah. So you heard it here. Be proactive, listeners. Go pick up the phone. Nothing is too small, and nothing is too small that you can't go and talk about and have a conversation with your GP and talk and make sure that you're getting that services and seen to. Thank you so much, Jazakallah khairan. We're ending this evening's show now. Thank you, listeners, for tuning in. Hope, inshallah, that we see you next week. Inshallah. Assalamu alaikum.